Hi, Dr. Elisha Van Duzen here with New Hope Chiropractic. Today I'm going to talk a little bit about the relationship between your feet and your spine and preventing back pain. It's been shown that patients treated with orthotics and chiropractic in conjunction had a 40.4% reduction in low back pain. So let me just take apart the anatomy of your gait cycle or your walking cycle for a minute. First of all, you have your heel strike, and that's where your heel strikes the ground, as the name implies. And study after study has shown that repeated impact between the foot and the ground can cause a wide range of injury, from stress fractures to cartilage breakdown, from shin splints to even low back pain. So, with force impact on the body created by each heel strike equals 3.5 times a person's body weight while running, 2.5 times a person's body weight while walking, 0.5 times a person's body weight in the neck. And that means that a person weighing 160 pounds feels 560 pounds of force while running and 400 pounds while walking, and 80 pounds of force in the neck on each heel strike. In mid stance, which is the next phase of your walking cycle or your gait cycle, at mid stance the foot flattens and is prone to pronation or hyperpronation, and this is the optimal part of the gait cycle. But excessive pronation can be seen and measured. So that's when your foot flattens and it kind of turns in, if you will. And an untreated foot rotates most often internally. So this rotates your tibia and femur. Those are the leg bones. And that torques your pelvis. And then that translates into the sacroiliac joint having problems. That's the joint between your pelvis and your spine, and this can create low back pain. And this is also the portion of the gait cycle that can create a leg length inequality, a functional leg length inequality, which means that the leg's not really shorter, but it appears shorter and functions in a shorter capacity because it's not properly aligned in the low back, and then that creates problems with walking and also problems in the entire back all the way up to the neck. So then the toe off phase, which is the next phase where the foot becomes a lever, that's where you step off and you complete the gait cycle. And if the gait cycle is dysfunctional during heel strike and mid stance, the toe off or propulsion part, the last part, can also be ineffective as well. And in fact, a recent study found that foot flare-up prior to and during toe-off can cause a runner to run up to an extra half mile during the course of a marathon. So orthotics, especially custom functional orthotics, can help the feet and this whole kinetic chain of the gait cycle and improve all three cycles of gait. All three steps of the gait cycle, and that in turn will help your back pain as well, and your whole spine to function better. So that's just one of the things we do here at New Hope Chiropractic. We check your entire gait cycle, and we look to see if your feet are a problem and can benefit from orthotics, and then we can make custom-made orthotics for you that are tailor-made to your foot and your gait cycle, and will prevent you from having cartilage and joint breakdown as well as back pain. And keep in mind too, until the 31st, we're having a special in the office here for $31, our October special. It's a complete consultation, examination, and report of findings and first visit. So it's a great value. Come and book your appointment at newhopechiropractic.com. And with that, I hope you have a healthy day.